Urinary incontinence is the involuntary loss of urine that is bothersome enough to a woman to be a quality of life issue for her. The quality of life component is really important. There are two broad categories of urinary incontinence. If we look at stress urinary incontinence, that's the kind of leakage that happens when a woman coughs or sneezes or exercises. It's due to a stress or a pressure that happens on the bladder from pressure that's transmitted from that activity. For many women, they first start noticing stress incontinence after they've had a baby, because we know that the tissues of the pelvic floor are often traumatized or stretched by having a delivery, but then over time, chronic things such as a cough, straining for constipation, a lifetime of heavy lifting, then progressively contributes to the worsening of the muscle tone and connective tissue support. And so stress incontinence usually is related to that loss of muscle tone. The other main type of urinary leakage is urge incontinence, also called overactive bladder. And this is a spontaneous spasm of the bladder muscle. I would always encourage women to talk to their providers, either their primary care doctors or their OBGYNs, about any concerns they're having about urinary leakage. And the most important thing to know is that they're not alone. About 1/3 of all women will seek treatment for urinary incontinence during the course of their lifetime. And so it's a very common condition, and I can promise you that your provider has heard this before and can offer you treatment options. What I love most about my job is allowing women to gain some control over a quality of life condition that can really impact their ability to feel good about themselves, to be social, and to be active. Many women with incontinence or prolapse describe a feeling of isolation, like they're fearful of going out, they may be fearful of being intimate, and by helping them with this condition, it just helps them feel better about themselves, improves their quality of life, and takes away some of those fears.